Good afternoon. Thank you for watching our live update for Tuesday, January 5th. Hope everyone had a happy New Year's as best you can, given the situation. Today, I have some information about the COVID situation and the vaccination process, and after me, Jessica Corbett, here from the theater, has an update from Resident Services, and then our chaplain, Logan Augustine, has a poem and a prayer for us today. So let me do a quick review of the COVID situation. Our local positivity rate that's used to determine Parson Health Center staff and resident testing, that rate is currently at 13.5%. 10% is the threshold where we have to begin to test staff and residents twice a week. And now we're 13.5, it's about the highest we've been. So we'll be testing, continue to test. We're testing 5 or 6 days a week. Every staff member and resident needs to be tested twice a week. The statewide positivity rate is also the highest we've seen it, 16.2%, and that's up dramatically from where it was before Thanksgiving. And really across the whole Commonwealth of Virginia, the positivity rate is going straight up. Chickahominy Health District, which is Hanover, Goochland, is currently at 16.8%, Chesterfield's at 16.1%, and Rico's at 14.1%, and Richmond, really one of the lowest in the area at 11.8%. Situation is really tough out in the broader community. We got some comments directly from Virginia Department of Health today about the situation in the Richmond community, and I'm quoting our epidemiologist: "The community spread is on the rise. We are seeing a huge surge in community cases. We saw a rather large surge after Thanksgiving, but we are seeing about double that amount in the community currently." That's directly from our epidemiologist at VDH. She also reported that long-term care outbreaks are being reported at a rapid rate. And really more concerning than just there's a lot of outbreaks is that the outbreaks that VDH is responding to, the cases in those facilities are doubling and tripling within days of each other. And so that's a really concerning situation, that the cases are spreading as quickly as they are in other communities. Thankfully, that has not been our experience in this most recent couple of cases we've had, but it is concerning that the community spread is as aggressive as it is right now. And so what I want to ask residents, independent living residents, if you're going to leave campus and be with friends or family off campus, please ensure that you ask them directly about being exposed within their personal circle, that those being family or friends or others that you might need to be with out in the community. If family or friends have tested positive or have been exposed to others who have been exposed, you're going to need to quarantine and let us know so that we can keep this community safe, because it is very prevalent. And those of us that live off this campus, almost all of us can say we know people who are either in quarantine or who are positive. So it is it's a very challenging situation out there. Let me move on now and talk a little bit about what's happening here on campus. So on Friday, January 1st, Friday of last week, we learned that we had 2 additional residents in the Parsons Health Center 3rd floor test positive. You'll recall that earlier last week, we had a resident and a staff member on 3rd floor Parsons who tested positive. So then on Friday, we had 2 more. That made 3 cases on our 3rd floor, and so we subsequently reopened our COVID-19 unit over the weekend, moved those 3 residents into a dedicated space where a dedicated team can work for them or work with them. Thankfully, one of the 3 that was moved over there, this first resident tested positive on Christmas Eve. So then later, I think it was yesterday or the day before, that resident is deemed recovered and has since been moved back to her room in Parsons. So now we currently have 2 people, both with mild symptoms, residing in the COVID unit. And that's, at this point, that's the extent of it. We have done another round of testing, and all the testing has come back negative, so we're hopeful. It's too early to say we're out of the woods, but it's definitely hopeful that we haven't had any more cases in the last few days. So more to come. We'll keep you informed. Hopefully those 2 residents the symptoms will subside, and we'll get them back over to Parsons and close the COVID unit back down. Routine testing for Parsons Health Center residents and employees continues twice a week, as I said, and those guidelines come to us from the Centers for Medicare and Medicaid Services, and we're going to have to continue to test twice a week all of that staff and residents until our community rate, as measured by CMS, Medicare and Medicaid Services, measures it a little bit different than VDH, but we get that from them, and they give it to us, and it's good for 2 weeks, so we know we're going to be in this twice a week testing for at least probably another 4 weeks at least, maybe longer. We also have some updates from assisted living this week. A non-clinical employee in assisted living, as well as a CNA from the Gables and Monticello, have both tested positive. All the residents in the Gables and in the Monticello are going to be in quarantine, and they'll all get tested. And then anyone additionally who's been impacted will be contacted directly by staff, and they're doing that today, or it's already done. It was done today, I believe. We also learned in the last 24 hours or so of an information technology employee that has tested positive, and that employee has been out for more than a week, and so we don't believe there's much risk there. A total of 7 employees are currently recovering in quarantine off campus, and that's been a pretty stable number. We've had 1 or 2 recover and a couple new cases, and so between 7 and 8's been the number for a few weeks now. We have several other staff, I don't know the exact number, off campus in quarantine due to either having some symptoms that are similar to COVID or after being exposed to someone who has tested positive. Now for the good news. We are really excited, and it's great news for our community, that the COVID vaccine and vaccination process began yesterday. Yesterday, in partnership with CVS Health, we vaccinated 117 out of our 120 residents in Parsons Health Center, and 171 employees got their first dose out of 2 of the vaccine. About 200 more staff vaccinations are going to take place today. The number was at about 145 when I came here to do this, and it's really exciting to see for staff to get the protection that they need so that we can feel more confident that they're not going to bring it to work, and so it's exciting. It's also exciting to get a first dose in everyone in the health center. It's a great first step, but it's just that, it's just the first step. CVS Health is running our vaccination clinics, and they will for all 3 levels of care here. The clinics are going well, and CVS, they're bringing 7, 8, 9 staff members here. The process is slow, and that's partly bureaucratic with paperwork and computer input, and part of it is just the nature of the way the vaccine needs to be administered. So I appreciate everyone's patience. Staff have been incredibly patient and tolerant because they have to wait in line for a good period of time, then they get the shot, and then they have to sit and be observed for 15 minutes. Takes a long time. But the good news is we really haven't seen any side effects or anybody with any real illness. A couple people complaining of a little bit of a headache or a little bit of a sore arm, but that's about it, and so that's really good news. Everyone who got vaccinated yesterday or today will get their second dose in 3 weeks, on or about the 25th and 26th, and that's really all we know at this point. We hope to have more details about the timing of the vaccine and vaccinations for independent living and assisted living residents. Many of you have asked, and I've gotten a number of emails, some very patient, some not so patient, asking about the timing of the vaccination for the residents in assisted living and independent living. And let me just say this, Westminster Canterbury is ready to provide that as soon as CVS has the authorization to proceed. But the process goes like this. Currently, we're in phase 1A of the rollout of the vaccine. In phase 1A, all residents of long-term care facilities, hospital staff, and first responders throughout the entire Commonwealth of Virginia need to be vaccinated before the program will move to phase 1B. My understanding is, and what's being shared at the state level, is that assisted living residents and independent living residents in communities like this will be in phase 1B. And so CVS will not be authorized by VDH, Virginia Department of Health, to provide vaccinations to the rest of our community until all of the long-term care residents in Virginia have had their vaccinations. And as I said, it's a slow process. And so there's a lot of nursing homes in Virginia, a lot of nursing home residents. And so that process, we got to be patient and let that play out. Those are the most vulnerable, and the communities have been hit the hardest by this. And so they really do need to get this vaccine first. And as the rollout picks up speed, I do expect that by the time they come back here in a number of weeks to do everyone else, the process will speed up dramatically. This process is regulated and controlled by the Virginia Department of Health, not by Westminster Canterbury Richmond, but we'll be ready to get you vaccinated as soon as CVS is authorized to bring it to you and administer it. You all will get the vaccine before the general public, but after everyone that lives in long-term care. That's what we know at this point. Lastly for me, just an update. You should have received a memo yesterday, I believe, informing you that Sherry Grady, our Vice President of Facilities Management, has resigned. She and her husband have decided to relocate back to Mississippi to be near their parents and family. We are sad to see Sherry go, but we completely understand. Her resignation will be effective January 18th, so in 2 weeks, basically. I want to thank Sherry for her time here at Westminster Canterbury and wish her and her family well in the future. We will start a new search to replace Sherry in the coming days. I believe the position will get posted today or tomorrow, and then we'll see where we go from there. So that's it for me today. I will see you again on Thursday. Next up is Jessica Corbett.
Good afternoon and Happy New Year to all. I wanted to let you know of a new short series that will begin tomorrow live from the Sarah Bell November Theater. For the next 6 weeks, we are launching a fireside series. This will be weekly live concerts in an intimate fireside setting right here in our theater. We have wonderful artists on the lineup, such as John Ballard, who is a classical banjo player, and the phenomenal Susan Greenbaum, who will sing soulful melodies, as she always does so well. I'm sure it will be a real treat for all of us and hopefully a welcomed respite in the middle of the day from the news cycle to just watch in a cozy way these wonderful fireside concerts. Tomorrow, we will kick off at 3 p.m. with Ken Kellner, who is a local jazz artist. He will be playing solo guitar and singing various jazz standards, so we will enjoy that concert. So the series kicks off tomorrow at 3 p.m., live from the Sarah Bell November Theater on TV 970. Look for the posters in the elevator soon that will announce the whole series. It'll be 6 weeks long, and I know we are going to enjoy it. And now a few additional notes from other resident services areas. From the salon thanks you for your cooperation and patience as we reopen the main salon. Please remember to wear your mask, avoid visiting with other residents or stylists while in the salon or in the hallway outside of the salon. Please no early arrivals as they need time to sanitize their work areas before allowing you to enter the salon. And as the salon works on their schedules, the number will be limited in how many people they can allow in. And unfortunately, the salon is unable to accommodate weekly standing appointments at this time. If you need to purchase any retail items or need to request service, please call 6281. If they do not answer, they are probably with another resident or sanitizing the space. So please leave your name and phone number, and they will strive to return your call within 24 hours. And lastly, from our wellness department, a reminder that the fitness and aquatic centers will be open by appointment beginning on Monday, January 11th. Please call to schedule your appointments for next week, and they will confirm your days and times with you. Thank you all very much, and next up is Logan Augustine.
Good afternoon. I'm Logan Augustine with Pastoral Care. Tomorrow is January the 6th, the feast day of the Epiphany, where we celebrate the coming of the Magi to visit the Christ child. We invite you to join us for worship this Thursday at 10:30 a.m. on TV 970. Reverend Dr. Lynn McClintock will preach, and Nancy Bain will play the piano. On this first Thursday of the month, this service will include communion, but it will look different than it has for us in the past. We invite residents to prepare their own elements, perhaps juice or a cracker, to receive during this service. For residents who believe differently about communion, we'll offer a prayer of spiritual communion. We recognize that this is different, yet we are grateful that we can offer this option until we can gather together again in person. The poem I have for you today is called Ring Out, Wild Bells, and it's by poet Alfred Tennyson. He writes about hope for the coming new year. Ring out, wild bells, to the wild sky, the flying cloud, the frosty light. The year is dying in the night. Ring out, wild bells, and let him die. Ring out the old, ring in the new. Ring happy bells across the snow. The year is going, let him go. Ring out the false, ring in the true. Ring out the grief that saps the mind. For those that hear we see no more. Ring out the feud of rich and poor. Ring in redress to all mankind. Ring out a slowly dying cause and ancient forms of party strife. Ring in the nobler modes of life with sweeter manners, purer laws. Ring out the want, the care, the sin, the faithless coldness of the times. Ring out, my mournful rhymes, but bring the fuller minstrel in. Ring out false pride in place of blood, the civic slander and the spite. Ring in the love of truth and right. Ring in the common love of good. Ring out old shapes of foul disease. Ring out the narrowing lust of gold. Ring out 1,000 wars of old. Ring in the 1,000 years of peace. Ring in the valiant man and free, the larger heart, the kindlier hand. Ring out the darkness of the land. Ring in the Christ that is to be. Happy New Year to all. As we say goodbye to the year 2020, let us welcome 2021, knowing that while everything has not been fixed by the stroke of midnight on January 1st, we are still on our way into a new year with new beginnings and new promises. Let us pray. Loving God, thank you for the gift of time. Help us to look forward to this year with hope and gratitude. Let us not forget the human need, injustices, and suffering that we witnessed and experienced in 2020, but help us to be moved by these things to act and make decisions that create a healthier, more whole community for us and for our neighbors. Help us to hold on to the value of slowing down, of taking time to care for ourselves and of reaching out to others. May we be kinder and gentler with each other as we recognize the value and sacredness of each moment spent together. Help us to lean into you amidst our own anxiety and uncertainty of the new year. Propel us into this new year with renewed strength, confidence, and hope for the future. For our faith and hope are in you, O God. Amen. Please join us on Thursday for our next live update.